Hello everyone, welcome to my channel Ravi Study Physio. So in the series of pharmacology, we are moving further and taking another topic which is peripheral muscle relaxant. So what is the meaning of peripheral muscle relaxant and why we are using indication, contraindication? So we are all are studying in this video. So before moving the muscle relaxant, first we know the why we are taking the medicine in this. So the peripheral muscle pain or their tone, decrease the tone and the decrease the neuromuscular junction activity if their person having too much tone, hypertone, tonicity, and there too much contraction or their spasticity occur, or also if there is doing any kind of movement, so it will be pain occur. So we are giving the peripheral muscle relaxant to ease the pain, release the tone to hypertone to normal tone. So that's why we are giving the peripheral muscle relaxant medicine. So these medicine are like analgesic or drug given on those time on the treatment or like surgical on the like orthopedic treatment surgery or like electroconvulsive therapy. On that time we are giving the peripheral muscle relaxant. So we are studying and moving the introduction. So these are the drug that reduce skeletal muscle contraction by acting at the neuromuscular junction or directly on the muscle fiber. It means it directly act the neuromuscular junction or the different skeletal muscle fiber to reduce the muscle contraction of the skeleton if their tone, if there is hypertone to go to the normal tone, and they relax the contraction if there is present in hypercontraction is any kind of skeletal muscle. They do not affect consciousness or pain sensation but cause muscle paralysis or relaxation. It means if the patient is taking the medicine, it show the analgesic effect, or if any kind of surgical treatment, so if so the paralysis effect or relaxation over the muscle, and it not defect, not, it will not harm or affect so in our consciousness, so the treatment will be occur smoothly. So these drugs are mainly used during surgical procedure, endotracheal incubate intube, or orthopedic manu- or surgery or electroconvulsive therapy. So these are some method, surgical method. So we are taking the drug of the on the patient. So next is to be classification of the peripheral muscle relaxant. So first, neuromuscular blocking agent. So it blocks the neuromuscular junction to not pass out the signal of the skeletal muscle. So these drugs are block transmission at the neuromuscular junction. Like first is non-depolarizing or competitive drug. So it blocks the neuromuscular junction. So they competitively blocks the acetylcholine receptor or motor end plate. It means there is any kind of contraction or like a efferent fiber take out the signal from the brain, so it stop the neuromuscular junction if different neuron or like different muscle fiber to not proceed further any kind of contraction or action in the skeletal muscle. There is example of D-tubuculin or panicronine and vanicronine. Vicurno, Vicurno, there is there is different so medicine. Please check the pronunciation if I am wrong. So if it corrected. And next is to be depolarizing neuromuscular blockers. So these neuroblockers, they cause the persistent depolarizing of the motor end plane leading to muscle paralysis. It means they will act directly on the neuromuscular junction and block the depolarization action of the skeletal muscle. It means any kind of polarization or depolarization and repolarization occur in our muscle for the different movement, so it act on the depolarization action, so not coming the calcium channel into the interstitial site of the tissue, and do not show any kind of contraction in the skeletal muscle. So there is one example is succinylcholine and succinomycin. There is a synonym and another name. So succinylcholine, there is bind to the uh, neurotransmitter or stop the action of the depolarization of the skeletal muscle. So first is neuromuscular blocking agent. Next is to be direct acting muscle relaxant. It means these drugs directly act on the skeletal muscle and ease the pain and relaxing to them. There is one example is dentroline. So what is the mechanism? So it non-depolarizing blocker acts as competitive antagonist of acetylcholine at nicotinic receptor. It means it prevents the acetylcholine to bind the receptors, and it will be not do further non-polarizing effects will be shown in our skeletal muscle. It means they block the action and there is no contraction occur in our skeletal muscle and ease the pain over there. So it prevents the acetylcholine from binding the receptor. It means there is end site of the uh, one neuron end, and there is a receptor to collect the signal of another side. So the blocking agent of the direct acting muscle relaxant to add here and do not move further of the neurotransmitter to perform any kind of action. So it will be block here neurotransmitter. So these blocks neuromuscular transmission in the cleft neuromuscular junction cleft. So effect no depolarization occur, muscle relaxation occur gradually. Depolarizing blockers. What is the depolarizing blockers? So in phase 1 block persistent depolarization of motor end plate and initially muscle fasciculation followed by paralysis. It means it will be not like suddenly it will be decrease the muscle contraction. It will be gradually or like persistently depolarization action showing on the skeletal muscle and initially fasciculation, so that in our paralysis in the, so it means first it will be ease the muscle pain, and so after that time it will show the paralysis occur, and after that will you can treat any surgical procedure over the patient. First is phase in this. Second phase is block. What is that? So it receptor becomes desensitized and muscle cannot respond to acetylcholine. It means now the patient have no any kind of sensation occur in their skeletal muscle. So or also the nearby the region. So if there is no any kind of sensation, so patient is ready for the treatment or the surgical over there. So in the phase 2 block is like that. And next is to be direct acting relaxant. There is one example is dantrolene. So dantrolene, what is the mechanism? So it inhibits the calcium release from the sarcoplasmic reticulum, reduce muscle contraction. It means dantrolene is taken the patient who have like a pain signals occur, and if the patient is taking the dantrolene, so it like same action is to be calcium channel blockers to not enter the calcium into the cell and block the pain signals and the into the sarcoplasmic reticulum and reduce the muscle contraction is hypertonia will be occur over the patient. So it will be take the direct acting muscle relaxation to ease their pain. Next is to be pharmacological action. So if patient is taking the peripheral muscle relaxation, so what their pharmacological action is to be there. So skeletal muscle impact. So what is their action in skeletal muscle? Because it will be directly act on the skeletal muscle. So muscle relaxation occur in a specific order. So what will be occur in like in the phase wise? First, the small muscle or of face and eyes, fingers and limbs. It means first it will be relax the face and eyes muscle, small muscle. Next is to be finger and limbs muscle. Next is to be neck, next is to be trunk, and second is to be intercostal muscle, and next is to be diaphragm. So simultaneously it will be relax the muscle of in their body. Next is to be therapeutic uses. So where we if we are performing the surgical treatment over the patient, so what is their therapeutic uses of muscle relaxation? So surgical muscle relaxation, endotracheal intubation. It means if there is patient is unable to take the respiration by mouth, so they're to like cut and incubation over the tracheal region. So it will be release the ease the pain over the tracheal region. Electroconvulsive therapy, it means there is a patient has to be too much like not controlling their mind and giving the shock treatment into near the head. So on those time we have to muscle relaxant is given to those patients to ease the pain during the electroconvulsive therapy on the patient. Orthopedic procedure, it means that during the treatment of the surgical into the knee hip replacement, so we are giving the muscle relaxation to ease the pain over there. Treatment of malignant hyperthermia, it means there is any kind of cancer treatment. So we are not in patient is not suffering for high pain. So we on the time we are also giving the muscle relaxation to ease the pain. Next is to be adverse effect of their medicine. So neuromuscular blockers, respiratory paralysis, hypotension, tachycardia, histamine release, prolonged apnea, succinylcholine, specific effect, so muscle pain, hyperkalemia, malignant and hyperthermia. It means if the patient is taking too much, if the patient therapist is given, a doctor is to given regularly this kind of medicine, so sometimes it will be show some kind of adverse effect on the patient. Respiratory paralysis, inability to incapable to take the respiration by their trachea, and hypotension, high blood pressure, tachycardia, high respiratory breathing is too much high. Histamine release, there is any too much in like unable to immunosuppression or like fight against the virus or antigen in foreign body, and like product prolonged apnea, succinylcholine specific effect, so muscle pain, if there is patient with succinyl specific effect, so it will be so the muscle ache, muscle pain, hyperkalemia, there is increase of potassium or calcium in their muscle, And the malignant hypertension, hyperthermia, it means if there is chances to be increased, the cancerous cell is to be pain over there. So that is the for the today peripheral muscle relaxation. Thank you.